Hello everyone. Hello from India. A heartfelt welcome to all the participants joining us from across India and around the globe. On behalf of the student of CSRD People's University, it gives us immense pride to present this special webinar led entirely by students for students. On behalf of our organizing team at the Center for Scientific Research and Development, People's University, Bhopal, India, I warmly welcome you all to the seventh session of the BioConnect webinar series. I am Tayyab Khan and I am proud to tell you that I am a student of BSc Biotechnology and I will be your MC for this program. It's truly a great honor to host this insightful event. Today's webinar focuses on a timely and thought-provoking theme advancing One Health for strengthening global health security. We are profoundly honored to extend a warm welcome to the distinguished dignitaries, thought leaders, and all participants of the program. A very special welcome to esteemed speaker, Professor Dr. Herman Barkema, a distinguished expert in epidemiology of infectious diseases, our Honorable Vice Chancellor of People's University, Professor Dr. Harish Rao, our mentor, Professor Dr. Subhash Bhore, Head of the Center for Scientific Research and Development at People's University, and Ms. Akansha Lodi, Chairperson in the organizing committee of this program. To formally inaugurate today's session, it's my honor to invite our Honorable Vice Chancellor, Professor Dr. Harish Rao, to deliver the opening remarks. Sir, over to you. Please proceed.
Thank you, Tayyab. Good evening, everyone. It gives me great pleasure to warmly welcome you all to the BioConnect webinar session number 7, a proud initiative of our students at the Center for Scientific Research and Development, People's University. This, for the student, by the student series is a unique platform that nurtures leadership, creativity, and knowledge sharing among our young minds. I sincerely commend our student organizers, their advisor, Professor Dr. Subhash J. Bhore, head of the Center for Scientific Research and Development of People's University, for their dedication in bringing global perspectives to our academic community. The theme of today's session, Advancing One Health for Strengthening Global Health Security, could not be more timely or relevant. As we all know, the health of humans, animals, and the environment are deeply interconnected. Emerging infectious diseases, antimicrobial resistance, and climate change are global challenges that demand collaborative solutions. The One Health approach is not just a concept, it is a it is a necessity for safeguarding the well-being of our future generations. We are truly honored to have with us Professor Herman Bakema, a globally respected authority in epidemiology of infectious diseases and One Health. His pioneering work and leadership in antimicrobial resistance and climate linked infectious diseases inspire not only the scientific community but also policymakers worldwide. We are privileged to learn from his experience and insights today. At People's University, we are committed to preparing our students to think globally, act responsibly, and contribute meaningfully to the society. Initiatives like BioConnect not only enhance academic excellence but also strengthen our students' confidence to engage with the world. With these words, I once again welcome all participants, thank Professor Barkema for joining us, and congratulate our student team and their advisor for the exemplary effort in organizing this event. I now declare the BioConnect webinar session number 7 officially open. I wish the session great success. Now I will hand it over to our MC. Tayyab, over to you. Thank you.
Thank you, sir, for Your inspiring words, your unwavering support for student led academic endeavors is sincerely valued and deeply appreciated. Now now I invite the chairperson of the organizing committee, Ms. Akansha Lodi, to say a few words. Akansha, over to you.
Thank you, Tayyab. Hello, everyone. Our esteemed guest speaker, Professor Harman Barkema, our Honorable Vice Chancellor of People's University, Professor Dr. Harish Rao, our mentor, Professor Dr. Subhash Bore, respected dignitaries, respected faculty members, and dear fellow students. I welcome you all to this exciting session of the webinar. My name is Akansha, and I am proud to tell you that I am an MSc microbiology student at the Center for Scientific Research and Development, People's University, Bhopal, India. It is a true honor to serve as the chairman of the organizing committee of this program. On behalf of the organizing committee, I warmly welcome all of you to this thought-provoking webinar titled Advancing One Health for Global Health Security. In today's interconnected world, the One Health approach, which recognizes the interdependence of human, animal, and environmental health, has become crucial with the growing challenges of antimicrobial resistance, climate change, and emerging infectious diseases. Strengthening One Health strategy is essential to safeguard global health security. Today's webinar will explore these pressing issues and highlight innovative approaches for building a healthier and more resilient future. On behalf of the organizing team, I am deeply honored to welcome our distinguished guest speaker, Professor Herman Barkema. I am confident that Professor Barkema's thoughts and insights will enrich our understanding of how advancing One health can help us collectively meet the global health challenges of today and tomorrow. With these words, I thank you all once again for joining us. Let us look forward to an inspiring and insightful session ahead. Now, I hand it over to our MC, Mr. Tayyab. Over to you.
Thank you so much, Akansha, for your encouraging words and welcoming remarks. Esteemed guests, fellow students, and distinguished participants, we now move to the heart of today's program. To take it further now, I hand over this session to our moderator, Mr. Uttam Singh. Uttam, over to you.
Thank you, Tayyab. Hello, everyone. A very warm welcome to all participants joining us from across India and around the globe. I am Uttam Singh, and I am proud to tell you that I am a MSc Biotechnology student at the Center for Scientific Research and Development, People's University, Bhopal, India. It is my privilege to serve as your moderator for today's insightful session organized under the BioConnect webinar series, an appreciable initiative of the CSRD People's University. Today's session focuses on a topic of significant relevance in today's fast-evolving scientific landscape. Today's talk will focus on advancing One Health for strengthening global health security. It is my privilege to introduce today's distinguished speaker, Professor Herman Barkema, a globally recognized leader in the field of infectious disease, epidemiology, and One Health. Dr. Professor Barkema currently serves as a professor of epidemiology of infectious diseases at the University of Calgary and holds the prestigious United Nations University Chair in Infectious Diseases in a Changing Climate. His academic journey begins with a DVM and PhD from Utrecht University in the Netherlands, followed by impactful early work in herd health management in Costa Rica and valuable epidemiological roles in the Netherlands. At the University of Calgary, he has made transformative contributions, founding and leading the Department of Production Animal Health and advancing multidisciplinary research with appointments across veterinary medicine and public health. He leads the Antimicrobial Resistance One Health Consortium and CAN AMR net spearheading efforts to tackle zoonotic diseases and antimicrobial resistance from a One Health perspective. Professor Barkema's research has not only driven scientific innovation spanning dairy herd health, mastitis, John's disease, and antimicrobial resistance, but also set a real-world disease prevention and control strategies in Canada, Europe, and beyond. His prolific output of over 425 scientific publications and his numerous international lectures underscore a career dedicated to advancing global health security. He is also a fellow and board member of the Canadian Academy of Health Sciences. Today, Professor Barkema will speak on advancing One Health for strengthening global health security, a subject at the intersection of veterinary science, human health, and environmental stewardship, areas where he has excelled as a researcher, educator, and global thought leader. With this very brief introduction, it is my honor to invite Professor Barkema to deliver the talk on advancing One Health for strengthening global health security. Professor Barkema, over to you.
Thank you so much, Uttam. It is a pleasure to present to you young people who are interested in One Health and are actually the future for us in the world. It's really inspiring to meet young people and to teach young people on this topic. We can all be in despair of what we see happening in the world, but we just need to roll up our sleeves and work and make a better world for our children and grandchildren that are to come. So the topic for the presentation today is advancing One Health for strengthening global health security. And I will first talk about why One Health approach is needed, then something about priority setting, and then I'll focus in on antimicrobial resistance as one of the issues that needs a One Health approach. So if you look at what's happening, infectious diseases and parasitic diseases, they declined in the Western countries, particularly in the 20th century. When I was studying veterinary medicine, they were closing down departments of parasitology, and it was difficult to get funding for infectious diseases. And that was the result of what we saw as urban sanitation, improved housing, personal hygiene, vaccination, and antiseptic. And then, of course, antibiotics really helped. And we always think that antibiotics are something that has been there forever. And for you young people, it certainly must feel like that. But it is only of the 1930s, 40s that it really became used. And as a result of all kind of things that happened, since the last quarter of the 20th century, we see all kind of new and resurgent infectious diseases. And we see all kind of surprises, like we call them. And here are some of the surprises, and I put here some pictures, and they are all from Canada, to things that happen in this part of the world now. And we don't have to think long about disasters that happen in other parts of the world. So we see quite some changes with climate change and antimicrobial resistance, vector-borne diseases. So it is not going as well as we thought 50 years ago. And this comes in the newspaper all the time. So here you see some other pictures of things that are happening. Bottom left, that is Ebola, as you may know, that happened in Africa. We see Zika virus in the top there, all kind of mosquito vector-borne diseases, avian flu, and of course AMR. So SARS-CoV-2 or COVID, the emergence of that woke up quite some people, but the reality is that it all the time needs new wake-up calls for people to still become interested. Yeah, where about 3 years ago, everybody was wearing a mask on the plane, and now nobody is doing it anymore. And we think that COVID is behind us. So if you then look at the human infections, and this is something that people often don't realize, that 3 out of 5 human infections are actually of animal origin, and that we get 5 new diseases annually. And if we look at the animal losses that we have in our livestock industry, 20% is because of infectious diseases. And we still have very limited understanding of the microbiome. And a lot we see all the time that people discover that chronic diseases are a result of infections. We then hear that MS, for instance, has the background, and bacterial background, and we don't know how or to what extent that actually is the case. So if you then look at the new emerging diseases, of course, CoVA, Zika, SARS, and it's quite a list of the last 20, 25 5 years. And we also see re-emerging diseases. TB is, and also people think of, oh, those things don't happen in Canada. Well, in the north, in the Inuit population and indigenous populations, TB is a big problem. Dengue is something that, we often think of your part of the world, but we now also have the mosquitoes that can transmit dengue in Canada, and we're worried that we will get it as well. So the plague that we think of something that is behind us is emerging, and of course AMR. So this is just an old picture, 20 years old, but about all kinds of diseases that emerged in the world. And here an older picture also of the economic impact, and we're talking about billions here. If we put here COVID in there, it would dwarf all the bars that we have here in this slide. So why is this happening? So we see an evolution of pathogenic infectious diseases. We see development of resistance to drugs, resistance of factors to parasites, and then, of course, the host, human demographic change. We see people going into new areas. The Amazon is for instance, an area where people are cutting the forest all the time and then go in there. Human behavior, drug use, different sexual practices, and then immunosuppression. In general, people are getting older all over the world, which makes the diseases that lead to immunosuppression, or the treatment leads to immunosuppression, more prevalent, like with cancer. And then we still have a lot of poverty. About 1.2 billion people in the world really are in areas with hunger, and we have social inequality. Changing ecosystems, climate change is a reality. Although some people in the world still are doubting this, that is of course nonsense. the climate is changing and it has quite an effect. Economic developments, like I mentioned, deforestation, but also urbanization. We see more and more people moving into the cities and living close together. Then food processing and handling, international travel, and commerce are really very, very prevalent. I traveled 200,000 miles last year. It was way too much, but if you travel everywhere, you bring diseases from one place to another. And we see that people that come back to Canada bring all kind of resistant infections with them, and that is not different for other parts of the world. Then this world, is in quite some unrest. We have wars occurring in places that we thought that would not happen again. I thought that never in my life we would have a war in Europe again. And we've had the Balkan wars, and now the Ukraine. We see what happens in Gaza. We see a lot of unrest actually in Africa. So that leads to movement of people, to hunger, and that breaks also the whole system that we have for public health down. So then also a deterioration in surveillance systems. And, we can look at what is happening in the United States with tearing down, the CDC funding, WHO funding that is completely, taken out by the Trump government, which has led to a lot of cuts in this important organization, the World Health Organization. I work a lot in antimicrobial resistance, and the group that works on antimicrobial resistance now is cut down to 50% of the people that were there a year ago, because of this large funding that was coming from the US and is not coming anymore. So, like I mentioned, 2/3 of the emerging infections come from animals, wild and domestic. We see influenza in the US now also in cattle, but geese, chicken, and pigs, avian flu. Then, of course, the animal displacement, and then humans come in different areas that they were never before. So, and then we see that modern warfare is breeding deadly superbugs, and we try to find out why that actually is the case. This is a recent manuscript in the New York Times. So we need to work on solutions, public health surveillance and response systems. And we need to detect them before they expand so far that we cannot control it anymore. And exchange information in real time. Think of the world as a global village and work together, and then contain transmission. People that don't want to work together and only look at other people like a potential enemy have not traveled much. The more I travel all over the world, and I also was in India last year, also in Pakistan, I've been 24 times in China, and what it's really encouraging going to these countries and see that there is a will to work together. That doesn't always mean a political will, but people all over the world are in general very good people that want to work together. But it requires infrastructure, it requires funding, and as we have seen in the last year, the political will is also very important. So we need, in my opinion, a One Health approach. We need to see all these things as a system, but we have complex problems that are linked between animals, humans, and the environment. And we also need a transdisciplinary team to really work together on these determinants of health in animals, people, and the environment, and create sustainable and equitable solutions. Because we want to improve the well-being of our people, but also our animals, and we want to also think of the nature and the environment, and because that is so important. Sometimes when you live in the city, people forget about this, but we are all the time, affected by what happens in the environment. We now in the cities in North America get a lot of smoke from wildfires that occur, and the smoke can travel thousands of kilometers. So the goal of One Health is acknowledge the interconnectedness of humans, animals, and the environment, and think of the complexity of these connections, and solve outside the traditional siloed approach. So we need transdisciplinary understanding and development of practical solutions to these complex problems. So if you look at this problem and how you deal with it, it's not just medicine or veterinary medicine or these hard sciences. We also need to work with people in the social sciences. Communication is important there, and also find out why has this developed, because often there is human behavior that is behind it. So we need to change that behavior, and we can only do that with sufficient knowledge of communication. And the communication, of course, is different for each country, each group in a country. And so we need to work together there. We need contextual and traditional knowledge. We need people on the ground. We cannot just stare at the computer and solve all kind of problems. We really need to go there and see what is happening. So we need practical and appropriate solutions. And then, of course, the things that we find need to be translated in enforcement, in policy. And we can make all kind of beautiful plans, and they are nearly all of them are called action plans, but there's only action when there is policy or enforcement. So all these problems like AMR, climate change, biodiversity, lack of biodiversity, and the pandemics need to be addressed together and are global issues. And we need to realize that you can put, if you have a boat with 5 holes and you fix 4 of them, that the boat will still sink. Yeah. So we really, really need to work together. So we need to take issues with the most impact. If you look at diseases, those are most often zoonotic diseases. We need cost-effective approaches. Of course, you want to pick the ones with low cost and that are highly effective. The approaches. And of course, low-hanging fruit to demonstrate success. But we need to realize that most of these problems need a very long-term approach. It took a long time for them to occur, and we need sustainable funding for a long term to really get these problems solved. We need surveillance all the time, and we need targets. When often I see these action plans without concrete targets. And also without really a good timeline. You need short-term objectives, you need long-term objectives. And when I take a plane, I hope the pilot knows where he or she is, where he or she is going, and then has a flight plan and also a time that they want to reach it. But the same is true for our approaches, our plans that we are making. But you need the prevalence or incidence of a disease to really being able to benchmark and to make targets. So we should have a short-term and a long-term time frame, and then make a plan together with all stakeholders. In most countries, it doesn't work that the people that are in power just tell the others what needs to be done. You need to communicate why this all needs to be done. And then during when the plan is implemented, we need to evaluate the progress. But long-term commitment is essential to these problems, and we see, and I've seen it a lot. I worked in the dairy industry, and they go from one disease after another. After 4 or 5 years, the plan to deal with a disease is not sexy anymore. And they jump to another disease. We cannot have that with these chronic diseases or these chronic problems that we are facing. And politicians, per definition, work in the short term. They're chosen for 4 or 5 years, and they want to do things in the short term. And that is not sufficient. We need long-term plans to get this done. And for that, organizations like WHO and FAO and WA and the UN are essential and need stable funding to do these things. There are many stakeholders in this One Health approach, not only veterinarians and physicians, but a lot of other people like social scientists, anthropologists, policy makers. We also need engineers. If we find out that water is a problem, then often you need engineers to make sure that people get clean water and are actually swimming in clean water. Pharmacists, of course, we need farmers, all kind of people depending on the problem that we are dealing with. But we need those politicians and bureaucrats also to be on board. And then, of course, and then I'm looking at you all, young people, capacity building is so important. We need to put, we need good young people to drive competitiveness and enable growth. So we need skills in our workforce to build the capacity to see the social, economic, and ecological concept of these One Health problems. And then you need to be savvy with data across systems to understand the system and inform policy and practice. And then create perspectives and discover the value that also diverse perspectives have. Social scientists come with completely different perspectives than veterinarians or medical doctors, and then work collectively and contribute meaningfully to transdisciplinary teams. And actually that is a lot of fun. Oh, of course, it's easy to work as a microbiologist in your lab and only do the things there. I won't say that the work there is easy, but it's easier than also talk to a social scientist or work with politicians and talk to patients and then work transdisciplinarily. So we need to make actions to really make a difference. And making this capacity building starts early in life. It starts in kindergarten. We need to, the teachers in kindergarten need to, and also the teachers in high school need to be aware of this. And of course, in university, One Health needs to become a foundation of the curriculum. But the thing is, when you graduate as a veterinary medicine or as a microbiology student or a medicine student, you have not even had one class together with people in engineering. And even veterinary medicine and medicine are silos. And if you then think of the 60%, two-thirds of the diseases in human medicine that come from animals, that just doesn't make sense. We need to work together. And we need, the best way to do that is doing joint projects together. So, and for that, we also need graduate programs in One Health. I don't think we need jack of all trades, masters of none. We really need microbiologists, veterinarians, engineers, but they need to be trained to work together. And then really work together in projects already in the university. So we need One Health graduate program, certificates, non-thesis masters, thesis-based masters and PhDs, and joint degree programs. And the ultimate of that would be, and that would be a dream of me, actually, to create an MD DVM program. Being a veterinarian, I think, oh yeah, humans, only one more species. So let's do, no, it's not, it's a bit more complicated than that, but it would be so good if people really have the knowledge of veterinary medicine and medicine together and work together. Summer schools are another one, in One Health, AMR. And then virtual and in-person continuing education courses. And we need international collaboration. We need joint degrees internationally. People need to get to know each other and learn to work together. So we need to attack these zoonotic diseases, but also, of course, food safety and sustainability. Food security is really important in all that. In an area that has hunger, yeah, we can think of working on antimicrobial stewardship, but we first need to feed the people, and having them, in the circumstances that they can think about it. If you have a war in an area, you cannot think about antimicrobial resistance. First, this war needs to end. So let's go to antimicrobial resistance. It is a very pervasive issue worldwide. And the antibiotics that were invented in the beginning of the last centuries are becoming less and less effective. We are doing at this moment a large prevalence study for WHO on the 16 most prevalent, most important diseases to humans, and we see that in a lot of areas antimicrobial resistance is increasing. And in your country there is quite an increase in that. So AMR may vastly reduce antimicrobial efficacy. So why is AMR a One Health issue? AMR is in animals, humans, and spreads through the environment. The environment often is a reservoir of antimicrobial resistant genes and antimicrobial resistant bugs. We use the same antibiotics in humans, animals, and also sometimes in the environment. 70% of the antibiotics used in humans are also used in animals. And those residues end up in the environment. Animals defecate, produce urine, and that comes in the environment. It's not just only contact between animals and humans that cause these transmission of bugs, but it often goes through the environment. And then if you look at drinking water, in a lot of countries only is chlorinated. And people, if you put drinking water under the microscope, you see all kind of interesting things in it. So antimicrobial resistant bugs and genes are drunk by people, and they also swim in it. In a lot of countries, they bath in it. So water is really important. So many factors actually contribute to the selection pressure. So, and there are also many similarities in the approach needed to reduce antimicrobial resistance and antimicrobial use in animals and humans. It takes the same approach to convince a pediatrician to not immediately give antibiotics to a child with fever, because most of those fevers are viral in nature. As you need to teach veterinarians to not immediately give antibiotics to a dog or to a cow. But we still don't know a lot about the environment and what actually the role is of it. So AMR development often the result of increased use, prescription taken incorrectly, often sold without medical supervision, a lot of preventative use. We saw during COVID that a lot of antibiotics were used because it was a very a-specific disease. So yeah, just to be sure, these people with symptoms were also given antibiotics, and we saw quite a rise in antimicrobial resistance in that time. And then, of course, yeah, there's quite some spread of resistant microbes in hospitals, but also in farms. Yeah, we see people like to go with an infection to the emergency room. Wow, that is really a dangerous place to be. It's a good place if you want to get infected. And then, of course, antimicrobial residues that go through the environment. So the perception actually is that antibiotics cure all, but it should become just in case it is needed. So we know that antimicrobial resistance goes from livestock to humans, humans to livestock, to pets to humans and whatever, but the role of wildlife is not really known. And how environment plays in that role also not. Aquaculture, in a lot of countries, like for instance Vietnam, you see a lot of fish being farmed, and we see a lot of antimicrobial resistance infections in there. So we need antimicrobial stewardship. My colleague Scott Weiss of the University of Guelph said it like this: antimicrobial stewardship represents giving the right drug to the right patient at the right time for the right reason, not just in case. And then WHO mentioned that every infection prevented is one that needs no treatment. We often see that bacterial infections are secondary to viral infections. And if people's humans and animals, if their immune system doesn't work perfectly anymore, what you see is that infections are spreading. So we need to prevent this infection, and often in animals that comes down to good husbandry and good nutrition. We need research and innovation. We need new vaccines, for instance. We need new treatments. We need to get to know how the environment works, what role it plays. What does wildlife play? Role does wildlife play? So, and then, and this just is from Nigeria, but drivers of AMR include unregulated antibiotic sales, proliferation of unlicensed medicine stores, shortage of licensed prescribers, poor AMR awareness, and use of antibiotics in animals without prescription. We need also people that become the spokesperson for antimicrobial resistance, and that's very difficult to get these people. Sometimes, ice hockey is a big sport here in Canada. I hope that a hockey player will get a resistant infection, of course, survives and become healthy again, but then becomes a good spokesperson for that, an advocate. In your country, that would be, for instance, with hockey or cricket. You need those people that are really, good spokesperson that people listen to just because they have the microphone. This is a picture made in Pakistan. And this is a store. This is just a picture made from the street in Pakistan. And you could very likely, the last time I was in India, I saw these kind of things as well. You can buy antibiotics or drugs in a lot of stores in the cities. So if we then look internationally, many countries do not even have a national AMR plan. And if there's a plan for AMR in humans, there's often none for livestock. And then they can have a beautiful plan, but then often they don't have the capacity to enforce regulations, or don't have the capacity also to really monitor the disease. We need benchmarking. We need to be able to look how things are going. And the AMR situation is particularly bad in LMICs and low and middle income countries. And we see that also in the systematic reviews that we're doing. And that's also because the access to diagnostics, healthcare, and proper antimicrobials is not good in LMICs, particularly in the poor people. We see that those things, if you're rich, you can do well everywhere in the world. But particularly the vast part of the population are the poorer people, and the rich people often don't think of those poor people. But guess where the infections then come from? They are at risk, so they should also see the society as something as a whole. And where they need to also think of other people. And then what we see, 30% of travelers come back with a more resistant gut microbiome. So the question is also, what is done in high-income countries to assist the lower middle-income countries? Because what we have seen is that when COVID occurred, it was everybody for their own with vaccinations. And guess where now the resistant strains occur? In the countries and that don't have the financial means to really control the disease. So WHO recommends, and FAO also has a lot of recommendations. They recommend stop using antibiotics in livestock to prevent diseases without a diagnosis. But of course, you need a very good health system to do that, veterinary health. They say that healthy animals should only receive antibiotics to prevent disease if they have been diagnosed in other animals in the same herd. Yes, I agree. That's possible in high-income countries. There should be overall a reduction in the use of all classes of medical important antibiotics. We have the class 1, 2, 3, 4 antibiotics, and we still see that a lot of the class 1 antibiotics that should only be there for people because they have our highest priority for people that they are used in animals as well, and we see a resistance occurring because of that. So measures to reduce disease, like the FAO says, switching to extensive production systems. Yeah, all nice, but if you want to feed your population of people, then it's very difficult to do this. We actually went more and more to larger farms with intensive production systems. Of course, that then you get higher risks for disease outbreaks in those herds, but we really need it. Of course, reducing stress is very important, and we really need to educate people that have those animals. We should avoid mixing species. We should avoid mixing animals coming from one herd to another. Good weaning practices, stocking density low, like I said, difficult, all nice. But with our growing populations in a country like India, you need to feed these people. And avoiding excessive herd or flock sizes. Yeah, I don't know. Um, if large farms are not necessarily always managed worse than smaller farms. Of course, we don't want the journey times. We see it in Canada, second largest country in the world. Calves are typically traveling for up to 3,000 kilometers to go to the veal producers. And yes, breeding for natural robustness and disease resistance is really important, but it's complicated with those diseases. And we still want those animals to be productive. So these recommendations apply to livestock farming in developed countries, but often not to the ones in developing countries. And these organizations that now work together only recently started to work together. And in most countries, government, veterinary organizations, livestock industry, and pharma are working separately on these issues. Even in North America, provinces and states work separately. And we see different things being done. Although animals and people go all over the country, also in a country like Canada, things are done differently in the East than in the West. And sometimes that is good because you can evaluate different ways of doing, but most often you also need to work together. And then in development countries, the pharma is really working cooperatively and they think about antimicrobial stewardship. And when I then come to countries like yours, I see that they are only interested in sales and try to push the sales of antimicrobials as much as possible. So we need to act. I often hear that resistance to penicillin is about as high since the discovery in 1928, but not increasing. But that doesn't matter. We need to be proactive. We see antimicrobial resistance increasing all over the world. And as a veterinarian, I swore an oath that I would help animals that are sick. And I really would like these antibiotics to be available when I need them to treat an animal. And the same for people, of course. So we should develop a target reduction in use of antimicrobials, as we've seen in some of the West European countries. So we need targets. And in these measures, that need to be developed commodity specific. And that also is for human health. Pediatricians should develop measures together with other people for pediatrics. But also cattle farming. Yes, the cattle farmers should be involved in measures for the cattle industry. So, and it will only work if they are regulatory or if farmers or medical doctors see the need and of the benefit to do it. They should see that it is something that is doable and doesn't cost too much money. So they need to see this, the need and a solution, and there should be alternatives for them. The financial burden should not be too high because then they cannot farm anymore. And experts in communication should be involved. And these experts should be familiar with the sector. So if you look in animals, disease can almost always be prevented by using good husbandry rather than prophylactic use of antibiotics. Here we now see, for instance, in the dairy industry, with the somatic cell count going down, and with it the prevalence of infections, that we can now do selective treatments of mastitis, and that we can do selective dry cow treatments. So if a commodity cannot keep the animals healthy without routine use of antimicrobials, they really should look in the mirror, and they should critically look for reasons why. Why are these animals getting sick, getting these bacterial infections? And then we need to work together across the world using the One Health approach. So hopefully, countries like Canada, but also the US and Northern Europe, hopefully we have learned from the pandemic. And we see that antimicrobial resistance genes will continue to develop in countries that cannot practice antimicrobial stewardship, because bugs don't stop at borders, so they go to these other countries. If we see what happens also south of our border in the United States, America first or Canada first for all kind of issues is not the way to go. It is simply, and I don't use this word often, it is stupid. And because it bounces back. If people in the US or in Canada think that way, they forget that these diseases, these issues come back. And we need to work together to address poverty, to address health issues in other countries, like the low and middle income countries. But we need to realize that people in these countries need to be able to feed their people. And then sometimes that the industries there may be economically dependent on the use of antimicrobials, and we need to work on husbandry there. So summary, and that's for the antimicrobial resistance part, antibiotics used in different sectors cannot be thought as separate actions. 70% of the antibiotics used in humans are also used in animals, and if resistance occurs in animals, it will also be transmitted to humans. So we need a One Health approach. We need a very much focus on infection, prevention, and control. But without international political will, this won't be solved. So we need this international collaborative approach. And that is what I have. We have different organizations at the University of Calgary and outside that I work with, and it is so inspiring to see all these people together. Good. I got some great questions from you, and let's go to that part of the conversation.
Uttam, please go ahead, Uttam.
Good. I'll stop sharing, stop presenting
Yes.
here. And
Thank you so much, Professor Barkema, for the insightful, inspiring talk. You have given us a deeper understanding of how advancing One Health and global security plays a crucial role in addressing global challenges and shaping sustainable solutions for the future. We will now proceed to the interactive Q&A session. Participants, please post your questions in the chat box or use the raise hand option if you would like to speak. While we wait for your questions, I will begin with a few to get us started. My first question is, Professor Barkema, in your views, what are the most pressing global challenges that the One Health approach must address today to strengthen global security?
Thank you, Adam. So, of course, number one, that I, as a veterinarian, and I'm also a prof in human medicine, that I think of are zoonotic and emerging diseases. I showed you what is happening. We get new diseases all the time. We get re-emerging diseases. In a country like India, with the population growing, with people moving to the cities, zoonotic and emerging diseases are still very important. So antimicrobial resistance, I talked enough about that. Food and water safety, because the diseases are often linked to contaminated water. But we also need to think about food security. Because if people are hungry, that antimicrobial resistance is the last thing they think of, and they're also more susceptible to diseases. Vector-borne diseases we see more and more occurring. Climate change has quite an effect on the vectors of diseases. Thinking of ticks, for instance, or mosquitoes. We see these animals traveling, to more colder areas as well, and we see the seasons that they can affect us change also. And then, of course, we really need to work on climate change. It is affecting us all the time. When I was in India and Pakistan in November last year, smog, when I was in Lahore, there was a lot of smoke all the time. And of course, these two countries, of course, the people in Pakistan accuse the people in India causing this and burning rice hulls and everything, and the people in India point the finger at Pakistan for the problems. Well, let's not go into the politics and of all that, but that's of course not the way to address these problems. You really need to work together, and if bullets and whatever are going over a border, that is not really helpful. So we need to address these situations that occurred in your country in the 1940s, and people in the area really need to work together. And that is the same. We now see Canada and the US. There won't be a war, but politically, there is a lot of upheaval, and the world is changing quite a bit. And as a result of the war in the Ukraine, we see now that the defense budgets of countries like Canada are going up to 5%. And of course, the things that you cannot cut are healthcare and education and whatever. So there's a lot of cuts in the high income countries in international development. So that is really unfortunate. So we really need to work together, and that's very difficult when you see these wars occurring. So those are the issues that I can think of, Uttam.
Thank you for that comprehensive perspective on the global challenges. Sir, you led major initiative on antimicrobial resistance. Could you share how AMR within One Health framework impacts global health security and strategies you believe hold the most promise?
So people and countries and politicians need to understand that bugs don't stop at borders. And they need to realize that antimicrobial resistance infections occur because of excessive use of antimicrobials. So we really need to be aware that this is a resource that we really need to cherish. But we need to to address this, we need integrated surveillance. Even in a country like Canada, if I want to compare antimicrobial resistance in livestock and in people, whoa, the hurdles that are there to really get the data on of humans and of animals and put them together are huge. Well, in a country like India, you often don't even have the data because in a lot of areas there is no proper surveillance, particularly in livestock, but also not in dogs and cats. We don't often don't have data in our pets, and particularly also not of wildlife. So we need, of course, responsible antimicrobial use. We need good plans that are actually policed. Yeah. And then, so stewardship, we need investments in new diagnostics. We need investments in vaccines. And people need to realize, though, that vaccines only work if the pressure of these bugs is not too high. So we need to control rare diseases through infection prevention and control. And then behind all that is public awareness. Because if there's no public awareness, there won't be political will to get these things done. So we need to work on that tirelessly to get these things done. And we need to work internationally. So these are the big things that need to happen. But we really need leaders to get this done. And I'm looking at you young people to work in this. You are bright young people and have a lot of energy. Yeah. So
Yes.
don't give up. Go for it. Because you won't have children now, but I have children, and I want them to grow up in a world where they can do the same things that I have done. And also the grandchildren that hopefully I want my children to wait a little bit because they're still too young. But then when we get grandchildren, I really hope that there is this beautiful, welcoming world for them to travel in and do the things that I can do, that I've done, because I've been very privileged.
Thank you, sir, for highlighting those strategies. How can One Health principle be better integrated into national and international health policies to ensure coordinated action across humans, animals, and environmental health sectors?
Well, a lot of the points that I addressed here for the last question actually, are also applicable to this. But we need information sharing. We need really the animal health and the human health and the environment health sectors to sit together and look what is occurring there. But again, political commitment and dedicated finances to this are really important. And to be able to make that, to do this, we need international collaboration. We don't need these leaders to fight with each other all the time, and who is actually the boss in the world, and all those kind of things. We need your prime minister and or Russia and Trump and all those people. They should work together, and not work only on what they see as their short-term benefit. They need to learn work term. Now some frustrations that I have with what happens in the world arise, come up. It is such a pity that that we see these things happening, and and when I see a parade and I see Kim Il Jong and whatever and Putin and all kind of people there looking at this parade with all these arms that have cost a lot of money, that we should not need actually. That money should really go to addressing poverty, to address diseases. And people should understand that we need to work together. Yeah, it's when people really get to know each other, they realize how great the people typically are, and that fights are just stupid. That we should not have those. So that is one. Yeah, yeah. Let's stop there.
Yeah, that's an important point of coordination, sir. So another global driver of health risk is climate change. From your perspective, what role does climate change play in the spread of zoonotic diseases, and how one health approach mitigate this?
Yeah, so now we know that these warmer temperatures that we face, and it won't be only warmer, because we see these rain patterns. We see all kind of natural disasters happening everywhere, and then we see that vector-borne diseases, in our case, are coming north. We see in India that the seasonal patterns are changing of the vector-borne diseases. We think that, at least. There's not enough good studies on that actually that are published, and that's your work. Yeah, you as students and as graduate students, together with your supervisor, you need to work on this and bring and map these things to see what is happening. Because if we don't know what is happening, we cannot make a plan. We cannot address these things. So these extreme weather events that we see are really also a risk of climate change. And that's what I don't understand sometimes of some farmers in the US and also in Canada are typically right-wing, conservative. They call themselves conservative. Then I think, yeah, conservative, does that also not mean conserve the environment? But okay, yeah. They should realize that we see these extreme weather events because of climate change. Then, of course, it can stress animal populations as well. Heat stress can be a problem. Now, heat stress even occurs in a country that is not that hot, like Canada, every now and then. But you guys know what heat stress is, and how it affects animals and people. And traveling a lot, and also I managed a dairy herd for 2.5 years in Costa Rica. It was getting to 50 Celsius at lunchtime with humidity in the high 90s. I know what heat stress is and what it does to animals and people. And with global warming, that is not nice. So, and that's, of course, we see these forests being cut. People focus on the Amazon. We also need to think of Central Africa. We have huge forests in Central Africa, and those are the lungs of our earth. But they then also say, yeah, it's all nice, you guys. I'm from the Netherlands. Well, there is no real wild area in the Netherlands anymore. Every square centimeter of the Netherlands is cultivated. And if you go to a forest, it's typically planted so it's difficult to point the finger at others there. They need to realize that it's so important for the earth, but it is really difficult to do that. So then, yeah, okay, stop that. My answer with that one.
Thank you for linking climate change and infectious diseases so clearly, sir. Hello, participants. Do you have any questions? If yes, please
Yes,
unmute
Uttam.
yourself and ask. Yes, sir.
Yes,
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 please.
Uttam. I want to say,
Yes, sir.
Professor Herman, I am very glad to attend this webinar, and you have given a great knowledge for our students. As you are a veterinarian, I want to confirm one thing. Actually, I have worked on Mycobacterium tuberculosis. We have got a sample also of Mycobacterium bovis, which has a very limited therapeutic treatment. Professor Herman, please, could you share your knowledge to our students, because our students are from rural areas? Can you tell our students which potential symptoms are found in cattle for the identification of Mycobacterium bovis? Because it is a zoonotic disease, please.
So here you're asking a guy who is in a country where TB is considered to be eradicated in most areas about the symptoms of TB. Now, I know it because I travel a lot. Yeah, and we every now and then get outbreaks, and you know the symptoms are we don't see often. What we detect it in a slaughterhouse. So surveillance in a slaughterhouse is very important. And then when you see these lesions, these abscesses that we see, and typically it's in the lungs or in the lymph nodes of animals with TB, then we go back to the herd and test the whole herd, and then we find that it is there well spread in the herd. The second step that we then need to take is from what farms did it get to this herd? Yeah, and we really need to look at and we find we need to do tracing, and we need to do backwards tracing and find and we often find for one herd about 1,000 herds that we need to check. But we also need to do forward tracing because we have it's a very chronic disease, and the moment that we find an animal with abscesses and with the typical tubercle TB lesions, then this disease is there already for a long time, and we often see that animals have been sold to other herds, and we have a lot of other herds that we need to check. But to do that, we need very good identification of the animals, and we need traceability. And in a lot of countries, you don't have that. So it's a big problem there. But we also need to realize that this is a zoonotic disease. So immediately, when we find cases like that, we need to test all the humans that have been in contact with these animals. Yeah? And then also the people in the slaughterhouse that have been in contact. So in countries like Canada, we like, particularly, let me say, Northwest Europe, we like to eradicate diseases like TB. But that also makes you vulnerable for outbreaks. So you need to have a system in place so that you can deal with these outbreaks. In the Netherlands, I worked a lot in mad cow disease, BSE, lepto, salmonella Dublin, all kind of diseases that we eradicate. But then, you're not on an island. Yeah, the diseases come in from places, and you need to have a very good monitoring system in place, and slaughterhouses play quite a role in that. To look at that, and in countries like in Northwest Europe, also monitoring, if you think of cattle, of the bulk tank milk is very important. Yeah, but what we often don't see is monitoring of our pets. Yeah, we are in very close contact with pets, and these animals can also get TB. Yeah, so if you have TB, there needs to be a very good monitoring system. Yeah, if you think about the animal health services in countries like the Netherlands, Germany, Belgium, and Northern Europe, all started because of TB. And that started in the 1920s of the last century. And they have eradicated by testing animals of every herd every year. Yeah, and then putting also preventive measures in place. So you need coordinated efforts to really monitor that, and then also isolate the herds that get these problems. Long answer to a short question, Ashik.
Thank you
Sorry.
so much. Thank you so much, Professor Herman, for giving this knowledge. Thank you so much.
Thank you, sir, for sharing the insights on tuberculosis. Participants, do you have any more questions? If yes, you can ask to the sir.
Uttam, please go ahead.
All right, I have few more questions, sir. What step can universities, research institutions, and governments take to build strong interdisciplinary global collaboration that advance the goals of One Health globally?
Well, that's also a short question, and sorry, it will be probably a long answer. So, because it's something that I work in a lot. Yeah, I'm also the co-chair of the advisory committee for the Public Health Agency of Canada. Yeah, and so there's a lot of that we think about the government and also within universities. I work a lot with all kind of universities. Like if our Can AMR net, we have 25 universities participating in that. So if you think, let's think of ourselves, universities first. Yeah, we need collaborative environments to work on these issues. It needs to be stimulated from higher up and also from the professors to that you as students work together on problems. Yeah. So,
Yes, sir.
but what do we see? We see silos in every university. It's not different in Calgary than it is in India. Yeah? If you work in microbiology, you often have never had any class together with medical students. The same with veterinary students. Yeah, and why are nurses and medical doctors? Why don't they have any classes together? I don't get it. Yeah. So, but then engineers, anthropologists, they don't even speak the same language sometimes, it seems. Yeah. So they don't know how they need to work together. So you need people to really get to know each other to create trust. Yeah? Trust is a key word for collaboration. If there is no trust, people won't work together. Have we seen that globally, like it described on these on our leaders? But it also works with working together to address these problems. You need to create trust, and you need people to get to know each other to create trust. Yeah, because if you don't get to know each other, that won't happen. So there need to be incentives also in our universities to do this. Yeah, often the only thing that is thought of is, oh gosh, we need a manuscript in the Lancet Microbe. Yeah, or in a high-end journal. Yeah, that's all nice, and I'm proud that we have manuscripts in there, but yeah, those things are not the only thing. We need to learn to work together and need to learn how to speak each other's language. And you guys need to be able to speak to the public. Yeah. and convince politicians and the public that these problems are real and that we need to work on it. So you need to learn about communication, and not only communication in scientific publications or presentations, but also how to talk with a journalist. Yeah. And also to stand in front of a group of concerned people. Yeah. When there is an outbreak of TB or another disease, how do you address these people? So we need integrated One Health education. Like I said, not only jack of all trades and masters of none. No, you need to be good in microbiology, or if you are a microbiologist, and you need to be good in epidemiology or whatever area that you work in. But you need to learn to work together, and really do things together, create trust. So that is some of the points for universities. So, and we need to support for joint research programs. And that's only what I have seen in the West in the last 10 years. Yeah, we see these larger programs like Horizon Europe, and I'm fortunate to get quite some funds for large programs where we work together. So we always had the funding of medical research through the Canadian Institute of Health Research. Veterinarians never got funded there. They were in NSERC, the National Science Research, while the social sciences had their own funding. Yeah, and now fortunately they pool some of the money together for joint programs. So I'm fortunate to lead a One Health training program on AMR. We just had a workshop in Montreal with 83 trainees from all over the country there that work in all kind of different areas. Yeah, so it is really important to bring these people together. And okay, government. Well, that is an interesting one often, because the bureaucrats are influenced by the politicians. Yeah, they can do all kind of things. Of course, you need to work with the people that work in the ministries and get them on board. But they can only do things if the political wind is in their sails. So you need development of supported policies to get these things done. And they also need to fund interdisciplinary research. And we see in government, the people from the Ministry of Agriculture don't talk with the Ministry of Health. And the Minister of Natural Resources not with the others. And you see silos. Yeah, and these silos need to work together. And we need dedicated people that make that happen. But it's only possible if you have the will, the political will there. Data sharing, so if we do surveillance and by public health institutes or whatever, it should be promoted that data is shared, not keeping close to the chest all these data because I want to publish it in this high journal or whatever. Or what we often see is not publishing data when it's not going that well. Yeah. When I'm in China, things are kept close to the chest often. Yeah. And that's not always a good thing. Yeah. So they really need to work together and be open, also between countries on what the problems are. So we need policies change. Yeah, you people, if you work on these problems, it only will have an effect if you have innovation, new technologies that come out of it, or policies change. So you need to learn how to work with these politicians. Well, they won't read papers in the Lancet Microbe or any other thing. You need to learn how to make a policy brief. Or if you sit with a politician, how you can do an elevator pitch on what you think is important. So you need to learn how to talk with these politicians, and you need to get what drives them. Yeah, and that is often not, is quite different of what drives you. Yeah. So and then of course, yeah, these WHO and the cuts that we've seen, and in the UN also. Well, we need to reverse that. We need more money to get to do these things. So again, a long answer, Uttam.
Thank you, sir. That's an excellent roadmap for collaboration. Sir, many young researchers and students like us are interested in contributing to One Health. What advice would you like to give them, and what opportunities do you see for the next generation of One Health professionals?
So you need to be good in the area that you are an expert in. Yeah. So really, if you are a microbiologist, make sure that you are a good microbiologist. Yeah. And that's the same for all the other areas. Yeah, because you need to be recognized. But then you also need to have experience in working together. So also in your program, try to include interdisciplinary research. When I did my PhD in the Netherlands, I did it on mastitis in dairy cows. And at a certain moment, I got a feeling that if I drove on the farm, and I had 300 dairy farms in my PhD program, I was working day and night because I wanted to visit them every 2 months, each of them. And I got a feeling when I entered the farmyard that I already could predict what the mastitis situation was. Looking just at the hygiene, how organized it was, speaking briefly to the farmer and what kind of person it was. So, and my supervisors then said, yeah, Herman, that's all nice, but nah. You know, what plays a role is post-milking teat disinfection, how the milking machine works, whether they use dry cow therapy and all those kind of things. And you don't see that when you go on the farm. So I went to Wageningen University, found this agriculture sociologist, Jan Douwe van der Ploeg, and we sat together and we put on paper what I thought that I was seeing. And there we found, and then I went back to my 300 farms, and I tried as objective as possible to answer those questions. And then I found out that farmers that were quick and dirty compared to clean and accurate had way more problems and a higher bulk tank somatic cell count and more contagious mastitis than the clean and accurate ones. So it really plays an enormous role how it is done. So I went outside of my comfort zone and learned actually that working with agriculture sociologists is really important, and developed a skill myself to do that. As a veterinary student, learning to work with medical doctors is really, really important. I mean, I have 50 cousins and 2 brothers. And one of my brothers is a dermatologist. And, they look a bit down on us veterinarians. Yeah. And well, so I was at a birthday party with my brother, and of course these guys only interact with other doctors and whatever. So we were standing there with 5 dermatologists, and I asked them, so guys, how many diagnoses do you guys actually have? And I said, is it more than 50? And they looked at me, and my brother also looked at Herman. Where's Herman going with this? Yeah, and so. And I said, yeah, how long is that education of you? And it's only on one species, I believe. Eh? And then they said, oh, the one who said, well, 4 years. I said, come on, guys, can you not do that in 4 weeks? Yeah, and so you need to every now and then make jokes and put them a bit down. Sometimes that works with my brothers. Be careful, because everybody, of course, has an ego. Yeah, but then they need to learn to work with you. And now I just actually published a paper with them on methicillin-resistant Staphylococcus aureus infections in the skin, also with my brother. Yeah? And yeah, you learn to work together, and we still tease each other all the time. Yeah, but yeah, that worked with us. So, Pom, but you also need to get out of your ivory tower, yeah, to learn about the situations in the field. Yeah, and see actually, and really do things that not only get well published, but also address a real world problem. Yeah, so go in the field, talk to people. Yeah, and it's so important for me to talk to rural veterinarians, rural doctors, on these problems. Yeah, so expand your network. Don't only stay in your small nucleus of people that work on this one disease or whatever. Yeah, really talk with other people on it. So, and I think, if possible, travel. Travel as much as you can to get to know other cultures, other people. Yeah, I mean, you will learn that there are actually a lot of good people in this world, that want to work together. And the people that are really against international collaboration, they often don't even have a passport. Yeah, they don't know other people, and they're just afraid of other people. So travel as much as possible. And sometimes it's scary, yeah, and you will make mistakes. Yeah, when I was a manager of a dairy farm in Costa Rica, I sometimes did things that I said, Herman, yeah, you should say things a bit different here. Yeah, this is actually offensive. Yeah, and you learn about that. Yeah, and yeah, so it's so rich to travel.
Thank you, sir, for those inspiring words for young professionals. Your advice will surely encourage our young professionals. All right, guys, I have one question from participant. So, it is possible zoonotic mycobacterium affects human, and how long latent time will it take?
For Mycobacterium tuberculosis to appear in people? Years.
Yes.
I mean, it's difficult to say. It depends so much on also on how good the immune system works of those people, and also the dose of infection is really important, and determines when actually an infection becomes apparent. We see infections of children that only manifest when they are an adult. So there are all kind of and we in Canada have a problem in our indigenous population. Yeah, our indigenous populations often are like people living in low and middle income countries. It's something that we should be ashamed about. Yeah, we still have 25 reserves, indigenous reserves, that don't have clean water. That water needs to be brought in by plane for those people to drink. So, and there we see also, because of the not suboptimal hygienic things, that there are, that there are TB infections, but also we see because of them not being treated well, we see a lot of drug use, alcohol use, and yeah. Well, I see a question on lumpy skin disease. Well, you need another person for that to answer that. I mean, I don't know enough about lumpy skin disease, and there will be professors in your university that know more about lumpy skin disease than I do. And you also, when you are an expert, you need to know what your limits are. You need to know what you don't know, and not just start talking about it like you know about it. I don't know enough on lumpy skin disease to answer the question that I just saw appearing in there. So sorry about that.
Thank you, sir. My last question to you, sir. Looking ahead, how do you envision the future of One Health over the next decade, particularly in relation to strengthening global preparedness for future pandemics?
Yeah, no, that's another small question. You guys have good questions, I must say. So, I've seen the knowledge about One Health occurring and growing in the last decades. But it is by still too much just a concept and not a reality in the field. So it needs to become more and more operational. Yeah. And really become a practice that universities embrace, that government embraces, that health systems embrace. Because if you ask the human doctors in Delhi, Calcutta, Mumbai, they won't think about animals as the source of the diseases. Yeah, and they don't. Yeah, some of them will think about the environment, particularly if they work in the poor areas of Mumbai. Yeah, but yeah, it is not in the health system, ingrained in the health system to deal with these things. And when you see outbreaks, so I worked a lot on COVID, and I wrote a couple of papers on COVID in India together with people in the Punjab. Yeah, and we discovered that the big problem with COVID, where all kind of measures were put in place, and then there is a religious event, and people come from all kind of areas to be together in these religious events, and all the efforts they were putting in place to not have people being together are gone. So you need knowledge about these things to work on that. We need operational systems that know about culture, that know about religion, that know how people are working together. And we need, policy change. We need legal backbones to get that done, and we need money. Yeah, money internationally to get these things done. Yeah, to also fund simple things like summer institutes, for students, graduate students, educational materials for teachers at schools, kindergartens, name it. We need awareness. Because the best people to convince parents are often the children. Yeah, and if they get education in those things, you get further. Then we need good surveillance systems. Yeah. And the government needs to put money in that, and it needs to be not short term. Those need to be long-term surveillance systems. Yeah, and of course awareness. With AMR, I see that all the time. We need awareness that this is a rising problem and that we need to address it, and that we cannot continue by just pumping antibiotics in people, because these problems only will get worse. And we see that now with wars. In the people that are shot often cannot be treated anymore with antibiotics. So people need to realize that. Yeah, when I see climate change occurring and I see people that even are at the presidential level still not believing that this occurs, then I think, gee, where have you put your head to with that? So lack of biodiversity is also this system that we live in on the earth is so complex. And if we just take one species out, then we've seen what happens in countries like Australia, where they introduce rabbits, and what happens then, or when we eradicate certain species that have that have a role as a predator in the system. It really affects everything. So those are some of the points that I can think of. And this is not small, but we need to work together to get these things done. And also, it's easy to say that countries like Pakistan and India, China, Bangladesh, name it, they all need to work together on this. Yeah.
Thank you so much, sir.
Let's
for
stop there.
insightful-
And,
Thank you so much, sir,
and
for
it's easy to
insightful.
say that as a Canadian now. So, yeah.
Yes. Thank you so much, sir, for insightful responses to all our questions. The clarity and depth of knowledge have truly enriched today's discussion. All right, hello students and esteemed participants. Let's conclude with a truly enriching discussion. On behalf of our team, I would like to extend our deepest gratitude to Professor Barkema for sharing his profound insights and expertise with us today. To all our participants, thank you for your active engagement. With that, I will now hand the session back to our MC. Thank you. Tayyab, over to you.
Thank you. Thank you, Uttam, for moderating the session. As we draw this exciting session to a close, I now invite Ms. Insia Qadri to deliver the vote of thanks on behalf of the entire organizing team. Insia, over to you.
Good evening, everyone. It is indeed an honor and a privilege to deliver the vote of thanks on the behalf of organizing team and the Center for Scientific Research and Development, People's University. As we draw the curtain on today's enriching session of the BioConnect webinar series, first and foremost, we extend our heartfelt gratitude to our distinct guest speaker, Professor Harman Barkey, for graciously taking time out of his busy schedule to be with us today. His insightful presentation on advancing One Health for strengthening global health security was thought-provoking and inspiring. Professor Barkema, your insightful and impactful talk has not only broadened our perspectives, but has also motivated us to envision opportunities in One Health only. We are truly grateful for the knowledge and wisdom you have shared with us. We also extend our sincere thanks to the Honorable Vice Chancellor of People's University, Professor Dr. Harish Rao, for his presence and encouraging opening remarks. Sir, your continued support is highly appreciated. Our heartfelt appreciation goes out to all respected dignitaries who joined us today. Your presence has added immense value and significance to this event. We extend our heartfelt gratitude to our mentor and guide, Professor Dr. Subhash Bore. Sir, your vision, guidance, and constant support have been the driving force behind this webinar series. Your mentorship continues to inspire, empower, and motivate us. We thank our moderator, Mr. Uttam Singh, for skillfully moderating the session. Our sincere thanks to the chairperson of organizing committee, Ms. Akansha Lodhi, for her support. I would like to take a moment to highlight the essence of BioConnect for the students by the students initiative. It stands as a testament to the remarkable heights passionate learners can reach when given a platform to explore, question, and grow. Though this series will not only gain insights from global experts, but also nurture a vibrant academic community driven by collaboration and curiosity. To our ever enthusiastic audience, thank you. Your participation, engagement, and thoughtful questions brought energy and substance to today's session. Your presence truly makes all the differences. And finally, we express our most profound appreciation to the management of People's University for their unwavering support and encouragement. Your belief in student-led activities such as the BioConnect webinar series enables us to dream big and achieve more. With that, I now hand it over to our MC to continue with the procedure. Again, thank you, Mr. Tayyab, over to you.
Thank you, Insia, for so eloquently conveying our heartfelt gratitude to our esteemed guest, our distinguished speaker, and every participant who graced this session. Dear participants, before we conclude, we kindly request you to take a brief moment, just 2 to 3 minutes, to complete the post-webinar feedback form. The feedback form link is posted in a chat box. Your feedback and suggestions are invaluable to us as they will help shape and enhance the quality of our future events. Please note that e-certificate will be sent to participants who complete the feedback form. We will wait for 2 3 minutes to let you complete your feedback form submission. We hope you have completed and submitted the feedback form. Please note that your e-certificate will be sent to your email ID provided in the feedback form. We sincerely thank you once again for participating in this enriching session. On behalf of the organizing team, we extend our deepest gratitude to each of you for being a part of this intellectual, stimulating, and truly enriching session. We look forward to your participation in the forthcoming session of the BioConnect webinar series. Until we meet again, stay curious, remain inspired, and keep building meaningful connections through science and learning. This is Tayyab Khan signing off on behalf of the organizing team at People's University, Bhopal. Wishing you a wonderful day ahead and continued success in all your endeavors. Thank you.